Welcome, and thank you so much for taking the time to be with us today. Most health plans know by now that the customer experience and meeting consumer demands is vitally important to remaining competitive today. This means paying close attention to how the consumer experience is perceived by every individual, and as experience will be reflected in star ratings and the bottom line. Today, we will discuss why it is important to be proactive and not reactive digitally by offering a hyper-personalized experience that puts data in the hands of those who are reaching out and connecting with your members. We will look at the role technology plays in uncovering consumer preferences with respect to Medicare shopping and enrollment, and offer some cool future perspectives on what we are doing at ConnectureDRX to engage your members on whole new levels. And even if you're already on board with the right technology, we'll show you why that's only part of the equation and how it is vital to have an extensive distribution network in place to connect all stakeholders, create greater plan visibility, and increase enrollments while keeping your members happy for life. I'm Amanda Woodman, Sales Executive for ConnectureDRX, focused on our health plan segment, and I'm thrilled to present today with ConnectureDRX Product Director, Beth Burke. So a few words about ConnectureDRX. Around since 2000, and if you're familiar with us, you might know us better as DestinationRx. In 2013, DestinationRx was acquired by Connecture to add Medicare and drug transparency to the overall product suite, and so today we go by ConnectureDRX. As a software company, we provide both SaaS and API solutions to health plans, multi-carrier organizations, agencies, and pharmacy benefit managers, all with the goal of pairing beneficiaries with their best fit Medicare plans. Our experience and expertise with therapeutic interchange, drug comparison technology, and analytics also allows health plans to improve the customer experience by connecting members to lower cost drug options, proven to increase medication adherence and elevate star ratings. We also have the largest distribution network in the industry, offering an easy way to connect health plan products to agents and agents to the products they sell, and enable our customers to create personalized messaging that leads to brand loyalty as members undergo potential changes in their insurance coverage. And we pride ourselves on being the gold standard in the industry for drug pricing, as many of you may already rely on us for our pricing expertise. We leverage plan data directly from our carriers and source prices at the pharmacy level and update our pricing data every 2 weeks. So let's begin by taking a look at your most valued end user audience, which is your seniors. It's important to understand what they have gone through in the past year and where they are today. So last year, seniors felt fear and uncertainty. They faced physical and emotional struggles, isolation, and boredom. And as their in-person world faded away, their digital presence emerged, along with the need for social connection and to get the business of living done. The seniors' ability to and their Medicare plan options became really critical. They had many questions and reached out via their phones and online for answers, and they were desperate to trust in the information that they received. The senior in 2021 is feeling more in control. So the vaccine has brought hope and places are opening up. Seniors are reestablishing their in-person connections. Seniors know prescription drug prices are too high and they demand to see prices before they pick up their prescriptions. They want lower cost options they can speak to their prescribers about. And compared to 2020, seniors will find it less difficult to get the right information to support their Medicare plan selections. They're more likely to change plans this upcoming AEP, attracted to a wide variety of supplemental benefits offered by MA plans. As the consumer experience rises to a frenzy across all industries, the consumer is indeed in control and starting to feel more empowered. So as the consumer is in more control today, digital engagement is becoming a business imperative and is proving to significantly impact the customer experience. E-commerce sales across all industries increased significantly in 2020, with 86% of customers spending more with companies offering a good customer experience. And the customer experience is overtaking price and product as the key brand differentiator, And today, 2/3 of companies now compete primarily based on their customer experience. Engaged members expect to have well-designed functional health management capabilities online, just like in banking and retail. Payers and providers are responding to the demand for retail-like experiences and treating consumers like they are king of the world. This is a shift from being reactive to being more proactive and preventative. People have come to want, need, and expect conversation in their interaction with companies they are buying from. And as a result, we saw that in the past year, habits have changed as well, especially with baby boomers and the elderly. So, for the first time, 5% of seniors tried video conferencing, 10% filled out an online contact form, 20% used some sort of social or text messaging, and 23% used email. So getting to know your customers better requires the right data, tools, and analytics to uncover the valuable insights. As you can see, it is worth the time and effort to pay attention to behaviors as well as a better customer experience drives revenue and retention. So let's dive a little bit deeper into digital engagement as Beth shares info about how to personalize the experience.
Great. Thanks, Amanda. So I bet you're wondering, what does it take to offer the ultimate customer experience where your members brag about your health plan, refer their friends and family, and stay loyal to your brand? Well, it boils down to offering an experience superior to that of your competitors. And it means having a digital engagement strategy that includes the right technology with the right data. Data collection is the key to personalization. Data can include demographic information, drug list, individual preferences and actions captured during the shopping experience, and more. Adding customer data to your shopping and enrollment platform before any calls take place really gives agents the opportunity to immediately connect with callers. It enables these agents to ask the right questions, but avoid having to ask unnecessary questions to take up valuable time and resources. Our health plans have been quite successful with data preloading on our Plan Compare One platform for Medicare quoting enrollment. In fact, one of our large regional health plan customers said that offering a more personalized member experience by preloading demographic and medicine cabinet information has cut down their agent call handling time from 20 minutes down to 7 minutes per caller. We begin with data preloading, and then using our technology, we dive deeper to offer an even more personalized experience. The goal of our customers is to connect seniors to their best fit Medicare plans as quickly as possible. To do this, we focus on a few key areas, including providing the most accurate drug pricing and reliable estimated out-of-pocket cost, both readily available and easy to see on our platform for both agents and seniors. But we also continue to evolve our technology beyond price considerations because we realize there are other factors influencing the ability to find a best fit plan to offer a hyper-personalized experience. A hyper-personalized experience allows health plans to target messaging uniquely to individuals on the platform wherever they may be in their shopping and enrollment process. Through either our API or hosted solution options, we focus on consumer preferences via a seamless guided help experiences. These preferences focus on health status, where you note whether a person is in good health, poor health, or somewhere in between, eligibility for low-income subsidy, providers, where you can easily find doctors and then tell if they're in network for available plans and identify your primary care providers. Prescriptions by building a drug list manually or through integration with Medicare.gov's Blue Button technology. Pharmacy, where you can choose multiple pharmacies and then view drug costs associated with these pharmacies and tell if they are standard or preferred for the available plans. Other preferences, where you can select plan benefits that are important to the consumer to display plans with those benefits included. There are lots of other ways you can personalize the experience for members. What the future holds really can get quite personal. So in fact, we've been looking at ways to start using video messaging so that when a member enters their platform, they truly have a unique experience with a video that pops up and says something like, "Hey Bob, we know your Gold Plus HMO plan has a recent formulary change. Rest assured, this happens from time to time. We want to show you some other plans based on your preferences that could save you money and be a better fit for you. We're also looking into consumer segmentation to give health plans the ability to provide different messaging and branding based on a consumer's coverage area. If this past year taught us anything, really it's to wash our hands. Just kidding, but really. It's really that you don't have to be face to face to still be able to provide an effective personalized experience. With people getting more used to video chat, we're looking at ways to integrate video chat within our shopping enrollment experience. The need for high-touch engagement has increased the demand for interoperability, secure platforms, and artificial intelligence in order to deliver a more consumer-focused service and prevention-oriented care. Health plans and multi-carrier agencies are under the gun to increase touch points with the members, driving adherence to medications, keeping beneficiaries in network, and enhancing communication with the goal of improving health outcomes and plan performance. We at ConnectureDRX pride ourselves in helping our customers create new engagement opportunities across all channels, broker, consumer, and call center. Our end-to-end approach enables our customers to develop relationships with agents and members to keep the connections going while adapting to changing needs. This omni-channel strategy leads to improved customer confidence. This stems from more informed decision-making, which in turn leads to more completed enrollments. Call centers provide personalized service in a shorter amount of time, and brokers use tools like quoting much more effectively. Brokers are also better to be able to manage their book of business from lead generation all the way through final sale. And let's not forget the value of direct-to-consumer channel as more and more tech-savvy consumers age into the Medicare space. Now Amanda is going to dive deeper into the importance of these channels.
Thanks, Beth. The customer experience is important in direct consumer, but it's also important to brokers and how brokers engage consumers. So I'd like to share the experience on one of our health plan customers that has our technology via our broker channel. A regional health plan customer that experienced the reduction in call handling times also uses shopping and enrollment technology to make brokers' lives easier. So as quoted by them, whether a broker has used the tool for years or it is their first time, the ConnectureDRX technology, the ability to email or text a consumer and get something back from them within minutes takes the enrollment experience to a whole new level. As brokers and consumers become more comfortable with technology, everyone is seeing business being completed a lot faster, and the digital transformation is appreciated by all stakeholders. Brokers work directly with members to complete an application via the means of their choosing, text, email, enroll. Both brokers and members found these digital tools very useful when in-person was not an option. Brokers can also text or email a scope of appointment for a member to sign and submit. They can complete a telephonic enrollment while talking to the member on the same call, significantly increasing their efficiency while reducing call handling times, as we mentioned earlier. Other important features that help brokers include quoting personalized URL, so tying brokers to every enrollment, and a retention site to help them retain them. And ConnectureDRX's Brokerlink is the largest distribution network in the Medicare industry, offering the greatest opportunity to get more eyes on plans and generate more quotes and ultimately get more enrollments. There's also a key component for delivering health plan and agency ROI. When talking health plans, combining our Brokerlink distribution network with Plan Compare One, the broker site, it offers dual distribution, leading to enrollment opportunities through multiple avenues. So our health plans see success with a dual distribution strategy. So for example, one of our larger health plan customers generated 50% of their assisted enrollments through Brokerlink and the other half through their direct broker portal. So the goal is not to limit yourself to one avenue, but to have multiple enrollment avenues continuously at your disposal. And today it's more important than ever to work with eBrokers and FMOs. No one can afford to have just one way to enroll. I'd also like to share a brief case study to show what can happen in healthcare when call center agents have what they need right at their fingertips and how it can lead health plans to higher sales growth and improved member retention. ConnectureDRX customer CDPHP faced a loss of members when employers dropped retiree coverage. Plus, they were significantly challenged by CMS call center requirements and had issues with staffing, among others. They stopped losing group members and increased access to new AEP and aging consumers when they opened new doors to their call center, increased access to multi-carrier exchanges, and employed the ConnectureDRX technology. Agents were able to cut down on questions using the member data in the Connecture platform. And call center agents provided a level of personalization that allowed them to relate to each member better, engage each person uniquely, and above all, they stayed compliant. This also helped to reinforce a strong CDPHP brand in the eyes of the customer. And the other results speak for themselves. CDPHP saw a 22% increase in call volume, a 23% increase in enrollments through a multi-carrier partner via our network, and ultimately reached 138% of their AEP sales goal. So now Beth's going to talk more about drug pricing transparency as an important part of the digital engagement.
Great. Since the beginning of the year, there have been more than 800 drugs with price increases. And most consumers don't even realize when their prices have increased due to high deductibles and high out-of-pocket cost. Sadly, many times doctors aren't even aware of the increasing costs either. A study earlier this year estimated that cost-related medication non-adherence will cause 1.1 million premature deaths among Medicare beneficiaries over the next 10 years. So, as drug pricing transparency becomes increasingly important, I ask you, what's your plan to offer lower-cost drug options to your members? With the right data, you can ask your members the right questions and show them specifically how and where you can help. These questions might include, are you having trouble affording your medications? Here's how we can help. Or, do you need a new prescription? If so, we can provide an alternative for you to discuss with your prescriber. We offer these proactive outreach opportunities through our database RX therapeutic interchange solution. When it comes times for CAP surveys, members will remember it was their health plan who helped them save money. Lower cost alternatives help improve medication adherence and are ultimately reflected in star ratings. This tool works in tandem with our consumer self-service option, Drug Compare, where a member can look up drug prices and options on the health plan website year-round, and then they can ask their prescriber about the options they find. As we know, for 2023 stars, experience, complaints, and access will account for 54% of ratings, and all other measures will add up to about 46% of stars. So, health plans are now pressed to think beyond actions to what constitutes engagement. Simply asking members about their experience at scale can provide both powerful insights and opportunities to connect members to resources to get the help they need. Some health plans are using conversational AI to provide concierge-level assistance to assist members in being able to navigate a plan, which is so fundamental to a good member experience. Personal and conversational touch is crucial, and so is finding ways to reach members who aren't engaging with existing channels. We need to know why members complain in order to get in front of those avoidable problems. According to CMS, members leave a plan when they find out a provider is not in network, a drug is not covered under the plan, or they're not able to afford the premium, and more. Providing this type of information is a cornerstone of our platform. Also, CMS makes a point of emphasizing that experience is not equal to satisfaction. CAP surveys want to know the consumer's opinion of the experience, not if they were satisfied. Experience and satisfaction may be similar, but they are different. People can be okay with their experience and still not be happy or satisfied with how the experience turned out. Now, Amanda's going to wrap things up.
Making healthcare more thoughtful and engaging through technology, training, and better communications is key. In summary, pay attention to these opportunities to connect. Use the omnichannel to unify the customer experience across devices and broker and consumer and call center channels to deliver an integrated experience that draws on your understanding of your customers. Be proactive with plan changes. Our consumer-friendly retention site allows health plans to customize member messaging when a plan or formulary is changing or discontinued. Know who will be impacted before they are. Call center agent training. Creating a positive experience that leads to brand loyalty often begins at the call center. Your best training practices can include valuable tips on how to optimize the customer data that's already preloaded onto your platform to ensure repeatable, compliant conversations. And lastly, use targeted outreach programs more effectively. We know medication non-adherence leads to poor CAP scores, so leveraging analytics tools like DatabaseRx can provide insight into those who are not adhering to their medication regimen. Thank you. We will follow up directly with any questions you may have regarding our presentation. We also encourage you to visit our booth. Also, feel free to reach out to marketing@connecture.com or visit our website where you can find our latest white paper, health plan solutions that impact the member journey, and more details on each of our solutions. Thank you.